A very common question that I hear at my office with patients coming in is, hey doc, I'm losing hair. What can I do? And a lot of people expect this very quick answer. Oh, let's do this, let's do that, let's see you in a month. But the bottom line is that hair loss is an extremely complex set of conditions. Every patient coming into the clinic is a special case on their own. We do generally have medications that work for special kinds of hair loss, and there are medications that work across the board. That being said, everybody must be evaluated individually through extensive conversation, meaning you've got to ask them how long has their condition been going on, what areas of the skin are affected, what factors might have contributed to it, what made it better, what made it worse, what kind of treatments have they had, in certain cases, what lab work or what other conditions they have that are associated with their hair loss, and in some cases, these people have had a scalp biopsy. Now, evaluating a patient is a very, very comprehensive and complex process. I usually take quite a bit of time evaluating my patients for hair loss, and a lot of the times we follow up with a scalp biopsy to figure out exactly what type of hair loss they have, because in some cases, and this is not uncommon, several types of hair loss overlap working together. They're not necessarily friends, but they're certainly not working against each other, and they're causing multiple issues that all must be addressed for us to stop the hair loss and possibly even reverse it so the patient can get some of their hair back. So let's talk about the most common types of hair loss we see at the clinic, and these are, by the way, all distinguishable one from the other, and they all are treated very differently from each other. They require special attention, they require special care, and then every individual with their own life circumstances, their own preferences, and the medications they like, the medications they're bound to respond to, all these things come together and further complicate the treatment of hair loss. Another complicating factor is that hair loss takes quite a bit of time to turn around, usually from a few weeks in the very short and fast responding cases of hair loss to many months or sometimes even long years until we're able to get satisfactory results. And that is not even a given. Some people never respond to treatment for hair loss. Those people have either permanent hair loss that is not scarring but just unresponsive, or they may have types of hair loss that are actually scarring, meaning the hair follicles are gone. They're destroyed by the condition that affected that person's scalp, and there's nothing we can do to retrieve those hair follicles and get that person their hair back. So let's go over a few types of hair loss and see what are some of the differences. So the most common types of hair loss are what we call androgenetic alopecia, female pattern hair loss, and male pattern hair loss. These are considered to be genetically determined, meaning the person who suffers from the condition usually has a family history of hair loss, meaning somebody inherited to that person genes that are making that person more likely to develop that type of hair loss. I've covered both female and male pattern hair loss extensively in previous videos. And just to reiterate some of the points that I've made, first of all, they are called pattern because they actually appear and affect a pattern on the scalp, a distinct pattern on the scalp. So they're not all over the place. They actually affect specific areas on the scalp. The other thing to know about pattern hair loss is that it's a chronic and progressive condition, meaning it keeps on moving along and advancing. It may not move very quickly, but in some cases, people experience these spurts of hair loss, and the hair loss advances very quickly over a very short period of time, and that sends the patient to the doctor's office very concerned for what is happening and what is affecting their scalp. The other thing to know is that this is not a scarring condition, meaning it does not cause permanent loss of hair follicles, but it may cause permanent hair loss in the sense that the hair loss in the follicles may not respond to treatment. So you have to find your happy medium, find the right treatment that works for the patient, that the patient is happy with, persist with the treatment to get, first of all, the hair loss to stop, and then possibly get some hair growth to occur, meaning the patient to get some of their hair back. In most cases, it's not all of the hair, but it's some of the hair. And then be patient enough to follow through and make sure you consistently use the treatment that got you the results that got you this far. A lot of people don't realize that the treatment for pattern hair loss is a lifelong pursuit, meaning the moment you get off the wagon, you fall off the wagon, you stop treating the condition, you will likely undo what you got in the course of the treatment. So that's very important to know. The second most common type of hair loss, and that is happily most of the times reversible, is telogen effluvium. Telogen effluvium is a more generalized type of hair loss, meaning it affects the entire scalp. It's usually very rapidly evolving. People come in very concerned because they've had extensive and massive shedding in the course of a few days or a few weeks from the beginning of the condition. It starts abruptly in most cases, meaning the person knows exactly when it started, either the day or the week when their hair started shedding. And this condition is caused by multiple factors, usually by a major life event that causes significant stress in the person's life, either some death in the family, God forbid, major surgery, in some cases, child delivery, birth can cause that to the woman who's had the kid, and there are other reasons or other causes. And the hair loss starts about 3 months after the major stressor occurs, and then the person has to contend with the hair loss. So what's interesting about telogen effluvium, and this is most cases, in most cases of telogen effluvium, especially the very rapidly evolving cases, the hair will grow back if you let it. And that's the happy news about telogen effluvium, is that you just need to wait things out. Unfortunately, most people don't have the patience to wait things out. Then they require some form of treatment. My recommendation for you is, if you've been diagnosed with telogen effluvium and it's a very confident diagnosis, wait this thing out until it comes back. It usually takes about 6 to 9 months for the hair to regrow almost completely. So be patient with this condition and make sure that you follow with the dermatologist just in case things don't pan out as you expected. Another condition that is very common, not as common as the previous two, but still very common, is alopecia areata. Alopecia areata is an autoimmune condition that attacks the hair follicles and causes hair shedding, usually over limited areas, usually in circles on the scalp. Looks like crop circles on the scalp. Usually occurs in younger people, either children or young adults, but some people who are older can get alopecia areata. And alopecia areata is usually a very benign condition, meaning it does actually reverse itself with some coaxing, with some treatment. It does usually require treatment from a dermatologist, usually by means of injecting Kenalog or triamcinolone in the United States, which is a type of corticosteroid, into the affected areas. And after a few months of treatment, the area reverses itself, the hair grows back, and that is not a scarring condition. There are some cases of alopecia areata that are very severe. In those cases can affect other areas besides the scalp. Obviously, major areas over the scalp. They can affect the face, they can affect the eyebrows and the beard area, and in some cases, other parts of the body. So if you're suffering from a major and extensive hair loss, go see your dermatologist, clarify the situation, and see what treatment would work for you. In the very extensive cases of alopecia areata, there are treatments to be had. Specifically, a lot of those cases do require systemic treatment with medications that work on the immune system, such as prednisone, such as methotrexate. And in the newer category of medications, there is the JAK inhibitor category that works extremely well for the very severe cases that we've gotten a lot of great experience with. So check with your dermatologist to see what's the right treatment to address your condition. Central centrifugal cicatricial alopecia, or CCCA for short, is another condition that is probably more common than we think. This is a condition that specifically affects black people, affects black women. It does affect black men, and we think it's actually overlooked in black men, thinking that their hair loss is actually attributable to pattern hair loss, male pattern hair loss. But we think this is a pretty common condition. This condition is genetically associated. Obviously, it occurs in black people in America. We do think that in a lot of cases, this may be associated with hair grooming practices, specifically those that cause irritation over the scalp, because the condition itself is associated with inflammation around the hair follicle. This condition, unfortunately, is often diagnosed late and it is a scarring hair loss condition, meaning it is causing irreversible destruction of the hair follicles over the affected area, specifically over the central scalp, and many a time more broadly than that. So this is a very serious condition to have. My recommendation to you, if you think you're losing hair, go see a dermatologist right away to make sure that we understand what type of condition is afflicting your scalp and what is the best approach to stop the hair loss from progressing, and what is the best approach to possibly regrow some of the hair. CCCA can be addressed by injections of corticosteroids to the affected areas on the scalp. In some cases, we can administer pills, and there are new reports, and I've had some experience with that, of platelet-rich plasma, which is a fairly new treatment technology for hair loss that can in some cases reverse hair loss, female pattern hair loss, male pattern hair loss, other types of hair loss, and even some cases of CCCA to an extent. Lichen planopilaris is another condition that is actually pretty common. It is an inflammatory autoimmune condition that also causes destruction of hair follicles irreversibly and can cause scarring hair loss on the scalp and on the face, specifically over the eyebrows. It is very common in women but can affect men as well. And this condition can evolve very rapidly, meaning it can sweep through the scalp over a few weeks or months and cause significant damage over the affected areas, some of the times irreversibly. Lichen planopilaris can appear as redness, flakiness, and itch over the scalp, combined with hair shedding, extensive hair shedding, and hair loss. If you're experiencing any of these symptoms, they're evolving rapidly, see your dermatologist for further evaluation and treatment so he can stop whatever it is that's affecting your scalp and possibly reverse it to the best of our ability. If you've liked this video, share, like, and subscribe. Put a comment in the comments section and tell me how's this video helped you or one of your loved ones to seek medical attention and stop that hair loss right in its tracks. Also, click the notification bell to let you know of upcoming episodes. More great content coming your way right from this channel. Thanks for watching, and God bless.